If you've just been prescribed Latuda, you probably have a lot of questions. Will it lessen or improve my energy? Will it help my mood or will it make me feel numb? What about other side effects? I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult psychiatry. I've prescribed Latuda to hundreds of patients, and today I'll walk you through what it really does, who it helps, and what to watch out for. Let me explain what this medication is supposed to do. Latuda, generic name Lurasidone, is an atypical antipsychotic with 2 FDA-approved uses. One in schizophrenia in adults and adolescents 13 and up, and the other is bipolar 1 depression in adults and in kids as young as 10, either alone or with mood stabilizers like lithium or Depakote. Most people know Latuda as a bipolar depression medication, and that's where it really stands out. It targets the depressive episodes that are often longer lasting and more impairing than the manic episodes for most people with bipolar disorder. People often notice improvements in energy, motivation, and emotional heaviness within 2 to 4 weeks after starting Latuda for bipolar depression. Now, dosing for bipolar depression usually starts at 20 or 40 milligrams with doses up to 120 milligrams daily. For schizophrenia, those doses are a little bit higher, usually starting at 40 milligrams and maxing out at 160 milligrams daily. Now, Latuda is unique. It's always taken once daily with food, at least 350 calories when you take it. Otherwise, it will not absorb properly and you will lose a large percentage of the medication through your stools. Clinically, we do use Latuda off-label for a variety of other symptoms, including irritability and autism, especially when we want something less sedating than other antipsychotics. We also might use it for mixed features in unipolar depression, although this is not an official indication. Now, let's talk a little bit about some of the side effects. The 3 side effects I tend to see most often in real life in my patients. They usually show up early and they sometimes fade or stabilize over the next 2 to 3 weeks. Nausea is very common. I do see that a lot. Restlessness or jitteriness, also known as akathisia, is fairly common. Some patients complain of lethargy, while others do complain of some insomnia. Now, the rare but serious side effects I have to warn about, although I have not seen them in my patients. Tardive dyskinesia is a long-term risk with any antipsychotic, less so with Latuda, but still possible. And I will make sure to give you a link to a YouTube video where I do a full deep dive into what tardive dyskinesia is and how to spot it. That's extremely important. Now, in patients under the age of 25, because Latuda acts as an antidepressant, especially in bipolar depression, there is less than a 1 in 132 risk of increased suicidal thinking. So it's something to watch for. I've not seen it occur in my patients, but there's a chance of that. If that occurs, they stop the medicine. It's not a good fit. Now, antipsychotics can, in rare cases, also cause something called neuroleptic malignant syndrome. Again, very rare, but it is a medical emergency, and I'll be sure to mention exactly what that is in my free Mind Vault resource, which will detail all of the side effects, all of the dosing options of Latuda. Here's my take as a psychiatrist who prescribes Latuda often. Latuda earns a top spot when someone is really struggling with bipolar depression, but does not want to feel over-sedated or gain too much weight. Latuda has much less weight gain than other medications that are used to treat bipolar depression on average, including Seroquel, Zyprexa, and lithium. I also use it off-label for patients who are on the autism spectrum and may have high irritability, other teenagers who may have significant mood swings, perhaps from DMDD that has not responded to non-antipsychotic treatment. Now, Latuda is FDA approved for bipolar depression, and it is not powerful at preventing bipolar mania. So this cannot be a standalone mood stabilizer in most patients who have bipolar 1 disorder. That is not 100% true. I do have some patients who swear by it as a standalone treatment, but I've had others who swore by it and then they did get manic on it. If you found this helpful, hit the like button and please subscribe. Then head over to drdaviddanish.com and explore that Mind Vault I was referring to. Inside, you will find all the pros and cons of Latuda and every other mental health medication, as well as free screening guides for you or your family around ADHD, anxiety, bipolar disorder, depression. I will also make sure you have access to that tardive dyskinesia resource in the Mind Vault. Thank you for watching. Stay curious and stay informed.